All right. Let's go ahead and go over this teaching project. All right, so you guys will all be one group in here since there's just 3 of you. But let's go over this. So there's 2 options, and you guys are welcome to choose either one. But I need to know probably by Thursday which one you want to do, because I've got to get it set up, if you want to go over to the elementary. So option 1 says you and your group will be teaching an elementary class about the importance of hand washing and infection and illness prevention. So it has to include some kind of activity for them, a game or a skit, some kind of activity, right? Something that you can do either for them or with them. And then a teaching plan that comes to me, like what you're planning on going over and what you're planning on saying and what your activity is that has all the details of that. And then some way for them to remember how long they need to wash your hands. And we'll go over the actual instructions on how to wash your hands later this week. But one reason we just did the growth and development chapter is because that gives you a better idea. Go back and kind of look at those notes or think through that growth and development. If you guys have Head Start or if you have 5th grade, you treat Head Start and 5th graders a lot different. And that's one reason I wanted to do growth and development first, and then we start this teaching plan. So here's what this one has to include. Teaching activity, you could do a puppet show. I have some puppets, game, video, a short play, or like a skit, something like that. Some kind of activity for them to be involved in or watch. A way for them to know how long to wash their hands. So maybe you have them sing a certain song. One year, I would suggest that you pick a song, like choose a song or make a song.
Or choose Barney.
Do it. Can you do a party?
No, Barney.
Oh, Barney. Yeah, I don't care what you do. So you pick a song that they know. But one year I had a group that asked, it was like 1st graders. They were like, what song do you know? Or what are some songs that you know, so they could sing it. And this kid stands up and starts singing this Black Eyed Peas song. Which one was it? It was one they did in the Super Bowl a few years ago. I don't know who Black Eyed Peas are. Is that one that was like real fast? But anyway, he sang the entire song. Every verse, every chorus, stood up and sang it. So it's better sometimes to have an actual song to give them or teach them than for them to come up with their own song, because then everybody wanted to sing their favorite song, So, and that's just learning as you go. That's part of it. You kind of, anyways. So, an age-appropriate teaching plan. So, like an outline or something that tells me how you're going to explain things, what questions you're going to ask, who is doing what. So, John is going to show them show them how to wash their hands or whatever it is. Jamie's going to explain why we wash our hands, whatever. And then you need to give those details on your teaching plan. And then teaching on the importance of hand washing and how to prevent sickness. So how can they prevent it? Keeping their hands out of their mouths, keeping their hands, washing their hands before and after they go to the bathroom. When do they need to do those things? Not drinking after someone else or eating after someone else. Whatever, however you want to word that. Okay, so that's option 1. Option 2 says that you and your group will create a video instructing your peers. So this will be for people your age, okay, like here at the school, on the importance of correct hand washing procedure. So again, age-appropriate techniques. You can use a lot more advanced techniques, obviously, for high schoolers than you can for, Head Start kids and stuff like that. So, but statistics, glow germ activities, etc., whatever you want to do. Make sure to include how long you have to wash them and how you do it correctly, and then why you should wash your hands. So if you're doing this, a way for them to know how long. So give them an idea. Maybe sing, you can sing the Happy Birthday song twice or sing your ABCs, whatever it is. Age-appropriate script or outline of the basis of the video. So that's what I'll want ahead of time. And then, of course, the teaching on hand washing and hygiene, how to wash your hands. So those are your options. You can either I'll set up for us to go to the elementary school. And what I usually do with that is I will send out time slots. Okay. So for you guys, you'll just have one. So we'll go over there at whatever time it is that day, whatever time in this class, 9 o'clock. And I'll just offer for each of my classes, I'll have time set up, and I will let teachers, elementary school teachers, I just send it to all of them and say, my students are available for teaching hand washing. These are the times, and they'll sign up. I just take them. So I won't know until I do that what age group you'll have. The teaching plan or copies, scripts, anything that you're going to use needs to be turned in to me on the 19th. And that's kind of like a first draft. It's not anything final. You'll also turn in a group grading rubric, so you guys will grade each other again, kind of like we've done in the past. And then there will be a presentation rubric for the teacher in the classroom. So that one that I always fill out for you guys when you do presentations, like 25 points, you'll take that with you for the teacher in the classroom to fill out. Or I will fill it out if you do a video. That's something that I'll do. Okay, so the back has the rubric and how it's graded. 25% is the presentation itself. 25% is the teaching plan. Okay, and those are kind of tells you it's age appropriate. There's some kind of creative activity, hand washing timing. It's organized, it's easy to follow, and it's complete. Right, it's got enough info there to fill up your time. Usually, it should take about 15 minutes. It could take up to 20, but it should be, it shouldn't be in and out. It should take a few minutes. And then the content. So the information that you put in there is correct, right? It's accurate. You're giving truthful information. It's complete. It includes what it needs to include. Hand washing teaching is included. Some kind of illness prevention. How do you keep people from getting sick? Keep yourself from getting sick. And then that it's at a good level for the students. So that's how it's graded. And then the other 25% is your group grading rubric. Okay, so this will be a test grade. This is a project grade. And it's a really fun project that I think you'll enjoy. And you'll have quite a bit of class time to work on it. We probably will not even get over to the elementary until like the 26th or 28th or something like that. So we'll have a few weeks. I will be out of town on the 21st, so I know we won't do it that week. Okay. So that's that. That's the project. And you guys can kind of talk tomorrow through that or which thing you want to do. If you want to do a video, if you want to go to the elementary. All right, let's finish up the PowerPoint. I think we should be to this part that has like the really dark slide. Finish. Did y'all finish the whole video yesterday?
Well, the bell rang on there.
Yeah, but you finished at least the part that I had recorded. Okay. Let's talk real quick. Let's kind of go over yesterday's talk. So we talked about the 6 links in the chain of infection yesterday, which were, let's go back over them real quick. 1, it says pathogen, right? Very beginning. Okay, that's the infectious agent. So the thing that causes the infection. What are some examples of pathogens or things that can cause disease? Do you get a cold? What causes a cold?
Bacteria.
Huh?
Bacteria.
Not for a cold, but yes, bacteria is an example of a pathogen. Colds are caused by viruses. Viruses are harder, you can't use antibiotics for a virus. Have y'all ever been to the doctor and they're like, you go in and say, you think you have a sinus infection or whatever, and they're like, oh, it's just a viral infection, and they send you home and don't give you any medicine. Or maybe they only give you like cough medicine or something. Okay, that's because antibiotics do not work for viruses. They only work on bacteria. So if you just have a viral infection and they try to give you these antibiotics, that can, one, it's not going to do any good, but two, it can actually make things worse later on, because the more you're exposed to antibiotics, the more resistant your body becomes to those, so they don't continue to work. That's why it's so important when you guys take antibiotics and you've got to, if it says take it for 10 days, that you take it the full 10 days. If you're one of those people who stops taking it when you start feeling better, that's a big no-no. Don't do that, because what happens is the next time you get sick with that bacteria, right, and you go to take that same medicine that's for that bacteria, that medicine's not going to work like it should, because it's already built up a resistance to it, So that's it. That's why it's really important to always finish taking your antibiotics all the way to the very end until they're gone, or until it says to quit taking them. Whatever the doctor's instructions are. You don't just take them until you feel better. All right, so that's the infectious agents, pathogens. So we said viruses, bacteria, could be a parasite, right? You have a worm, it can cause disease, illness. There's lots of parasites. However, if you look up parasites, Google it, you'd see some really nasty. I've seen pictures of like worms in people's eyes and stuff. Gross. I read this story one time, this is really gross too, about somebody who like licked an envelope and there was like cockroach eggs or something, and it hatched in their tongue, and like, I don't know if that's real, but that grosses me out. Anyway, I would think that would be considered a parasite. Those are things, a fungal infection. Have you guys ever had a ringworm?
Yes.
That's caused by a fungal infection.
I used to get them.
Oh, me too.
Right,
if you ever have a ringworm,
bad.
sit at the back of this room, because all I have to do is look at you and I get one. I don't know why, but
I used to get them around my nose.
I had one on my head.
I went to the doctor about it because I was getting them all the time, and they said it's just because the skin around my nail and all that was dry. So I just put like lotion and all that on, and I haven't got one since.
I just carry it there. I don't know. I got one on my head one time. When you get them on your head, it makes your hair fall out. So, and it's like real dry and scaly. And because we had like a new cat or something that I think had one, and I still don't do cats. That's why I don't know anywhere. But anyway, it was like right here. It's like the size of a quarter. It was huge, and we could not get it to go away. So I wore my hair in a side ponytail for like the whole year of school, because that was the only way to cover it up. Yeah, it was bad. I have bad ringworm experiences. Anyways, all right, second link in the chain of infection is the host. So that's the person or the thing in which the pathogen lives, okay? Now, fomites, we talked about that word before. Fomite is a non-living object that harbors pathogens. So your desk would be considered a fomite, or your pencil, something that's not living but can still carry germs. Okay, so sometimes that can be the host per se. Now bacteria can't live on non-living objects for a really long period, but they can for a shorter time. And viruses can live a little bit longer because they have this like hard shell around them. That's one reason that medications don't work very good on viruses. It's really hard to break through their like outer shell to get to them. Anyway, so that's an example of a host. Sometimes you can be a host. I think I talked about this yesterday, a carrier host, and not even have symptoms. You can just carry it and pass it to other people, and they don't even know. Okay, third thing is the portal of exit. So how does it leave the host, right? What are some ways that if you're sick, you're the host, it leaves your body? Coughing, sneezing, any kind of fluid, really. If you drink after someone and you leave your saliva on their drink, then they drink it. That's a way for it to leave your body and enter theirs. any kind of body fluids, blood, urine, anything. So that's a way that it can escape, breaks in the skin, right? Route of transmission is how it's moved, right? It's how it goes to the next person. So again, coughing, sneezing, shaking hands. Sometimes it can just be, here's what I always think about. Somebody goes to the bathroom, don't wash their hands after they go to the bathroom, and they just think, and people do this all the time, they're just walking down the hall, rubbing their hand down all the lockers, tink, 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 all the way down. Just hit every little combination lock all the way down. They didn't wash their hands, they went to that. Then you go to your locker, right? You put your hands up on your locker, dial it in, put your combination in, grab a snack, right, at your locker, eat a few chips or whatever you have in your locker, close the door back. Now, what's happened is you didn't even know, but you have, that germ has been transmitted to you. They didn't wash their hands in the bathroom. They touched the combination part of your locker. You touched it, then you fed yourself. There was transmission in there, right, using a fomite. The locker would have been a fomite. And then, you entered that into your body. Pretty gross when you think about it. I always wash your hands before you eat something. Air, insects, all kinds of stuff. Fifth is the portal of entry, so that's how it gets into the new host. So somebody sneezes, you breathe in the droplets that they sneezed out. Maybe somebody's been sick and they've coughed all over your desk, and then you get really tired and you put your head down on your desk, and you put your pen down on your desk, and then you pick up and put your pen in your mouth. Kind of gross, isn't it? Or you put your hands on your desk, you're working, and then you start rubbing your eyes. Another way for germs to get into your body. And then last one is the susceptible host. So this is the person that is receiving the germs. Now, some people, like I said yesterday, are more apt to get sick than others, right? If somebody has an immune system, their immune system is compromised, maybe they have some other kind of long-term illness, or some other examples we talked about. People who are on any kind of anti-inflammatory medicine, like steroids. I'm not talking about steroids that make you get muscles, but like if your knee swells up and they give you steroids or a steroid injection, or you have an asthma attack and they give you steroids to decrease inflammation. Those steroids do decrease inflammation, but they do that by decreasing your body's inflammatory process. So it decreases your body's ability to fight off diseases as well. It's one of the side effects of steroids. It can make you get other diseases or sicknesses easier. AIDS patients, obviously, because their AIDS is an immune disease, autoimmune deficiency. They're deficiency in their immune system. So, of course, they're going to be more apt to get sick. Cancer patients, because their cells are not doing what they're supposed to be doing already. Infant and elderly patients. Why infants? Why do you think they are so quick to get sick? Right. You guys have 14, 15, 16 years of your body being exposed to bacteria and viruses and everything else. What in your body fights those off? What are those called?
Leukocytes.
Yeah, white blood cells. Looking for a word starts with an A. Starts with anti. Antibodies, right? So let's say you get chickenpox. Okay. Your body creates antibodies that float around in your bloodstream to fight off the chickenpox. Takes a little while because the first time you're exposed to it, you don't have any of those antibodies yet. So it takes a few days for your body to work to fight those off. Okay, but what happens the next time? 2 years later, you're exposed to chickenpox. Your friend has chickenpox, and why would you not get it?
Because you already had it, so your body's
right. You've already had it. Your body's already made antibodies. So as soon as you get exposed to that virus again, your body's already ready to fight it off. It doesn't take you a few days to build up antibodies. You've already got the antibodies, and they're already ready to attack. So it's not that you don't ever get exposed to those diseases again, or that, or that you just can't get it. It's that your body's already ready to fight it off. It's already prepped, ready to go. That's why you get immunizations. They expose you to enough of the disease that your body recognizes it, makes antibodies, and so if you ever get exposed to it again, your body's ready to fight it off. Okay? Well, newborns, infants, they've only been around for a few weeks or a few months. They haven't been exposed to very much yet, so it's really easy for them to get sick. That's why if you ever want to hold a newborn, what do they always make you do first? Wash your hands. Right? That's because you don't want to give something that you could be carrying some kind of bacteria or virus that you're not getting because your body can fight it off, but they may not be able to. This is one of the biggest things with breastfeeding, why breastfeeding is such a benefit to the baby, because when a mom breastfeeds, that milk actually contains the mom's antibodies. So when the baby takes that, then if they're exposed to something the mom's been exposed to, they've got antibodies to fight it off. Now, they won't always have those antibodies necessarily, but they have them for that time period. Pretty cool. If the mom gets sick while she's breastfeeding, her body starts making antibodies, passes those to the baby doesn't get sick with whatever the mom has. Pretty cool, huh? I think it's cool. Okay. So that is infection control. So the point of what we're going to talk about today is when you think about those 6 things in that chain of infection, you have to have those 6 things for an infection to occur. And that's something to think about. Anytime you're sick, it's because if you got it from someone else, it's because all those things had to take place. There's something that caused it, right? There's somebody that had it. They had to leave their body, however that may be, and it had to be transmitted to you. So you touched them and touched your mouth, or touched them and touched your eyes, or touched them, or they sneezed on something and you touched it and fed yourself, whatever it may be. So that had to happen. Anytime you get sick, those things had to happen in that process. And then last is susceptible host. The way to prevent that is get lots of sleep, right? Get the sleep that you need, not necessarily a lot, but get sleep that you need, and eat a good balanced diet so that your body is prepped and ready to go and you're not more susceptible to those things. So that's what the goal is, to break. One of those 6 things has got to be stopped in order for infection to not occur. And so for healthcare workers especially, it's important to prevent that, because what do healthcare workers do? Or at least most, if they have direct contact with the patient. What do they do? Yeah, they're caring for them right there. They're in the room with them. They're giving them medicine. They're up close and personal, okay, with the person who's sick. So there's got to be a way to prevent, to break off one of those 6 things so that healthcare workers aren't sick all the time. Otherwise they would be. So that's what we're going to talk about today. What do healthcare workers do to prevent that? All right, so infection control. It says signs and symptoms of infection. So infection occurs when a pathogen, right, an infectious agent has entered into the body of someone and then they get sick as a result of that. So infection can be localized or it can be systemic. Localized means it stays in one area, right? It's local. So you get a cut on your finger and you notice a couple days later it's kind of turned red. Maybe it's pretty warm around the edges and it's hurting a little more than it was already. Maybe it has some drainage, right? Not just clear drainage is usually fine, like that clear, yellowy clear drainage. That's usually just serous fluid, kind of like plasma from your bloodstream. Same idea. Okay, but if it turns yellow or thick or gets opaque where you can't see through it, or green's never a good sign. Those are ideas that you've gotten an infection. But that would be local. Now, if you were to let that keep going and it didn't get better and it gets into your bloodstream, then you have potential for a systemic infection, which means it affects more than one system. If it gets into your bloodstream, it's been on your skin, it's in your bloodstream, you've got more than one system involved. Usually that looks like fever, right? Malaise, you know what malaise is? Like weakness, or they're really tired. Decreased appetite, swollen lymph nodes. Where does the doctor usually check for your lymph nodes? Up under your throat, right? Under your jawline. And you've got lots of lymph nodes. They're behind your ears, groin area, armpits have lymph nodes. And sometimes I can, if I have like my tooth is hurting, or if I get an ulcer or something, I'll get them in my jaw right here. Ever had one there? They kind of move around. Actually, because I have a tooth that's hurting. Anyway, so those are systemic signs. Those are signs that it's gone beyond whatever, wherever it started locally. All right, nosocomial infections. This is a special kind of infection that is acquired at the hospital. So what that means, let's say I go into the hospital to have my knee replaced, and while I'm in there, I end up getting a staph infection. Okay, that staph infection would be a nosocomial infection, right? I went to the hospital, I didn't have the infection, I had something else that was unrelated, and then all of a sudden I ended up with it. Okay, it's hospital acquired, got it at the hospital. And it could be from a worker who maybe didn't wash their hands good or was carrying something on their clothes. Usually hand washing is the culprit. Could be from some piece of equipment that had germs on it that didn't get cleaned good. Could be from somebody else. So a visitor comes in and brings along. Those are some ways that nosocomial infections begin. Best prevention is hand washing, and that's for any illness. We're going to talk about hand washing a lot, but hand washing is usually the answer. Okay. But that's the best way to prevent any kind of sickness. It's just simply hand washing and doing it correctly. Now, if you just run your hands under water for a second and then dry them off, that's not hand washing. That's not going to do anything. Two examples of nosocomial infections are, first one is MRSA, methicillin-resistant Staphylococcus aureus. So this is a staph infection that's resistant to methicillin. What does methicillin sound like? Penicillin. It's a type of medication. Yes, it's a penicillin derivative antibiotic. So what this means is that this particular staph infection is resistant to a lot of antibiotics. I mean, you can't just take, let me give you some antibiotic pills to take home and it'll get rid of this infection. It doesn't work like that. It takes weeks, usually weeks, depending on how the infection is, of IV antibiotics. If you get a systemic MRSA infection, I remember being in nursing school and having several patients that, had just had to stay in the hospital. Their surgery was done and it was better, but they had to stay in the hospital because they had gotten either MRSA or VRE, the other one on here, and they had to stay and just get antibiotics. Miserable existence. Also had a lot of home health patients that I would go see once a day or twice a day, and they would need IVs at home for these antibiotics because you can't just take them by mouth. They're not strong enough. And the medication for MRSA, the first medication, is actually vancomycin, which is, if you'll notice, the next one. Vancomycin is a really heavy-duty antibiotic. It can make you really sick. They have to check your blood levels before they give it, and check them again after they give it to make sure, because if you have too much in your system, it can make your kidneys quit working. It can make you go deaf. I had a patient one time who went deaf, they think, because of vancomycin. Lost her hearing because she had too much in her system. So this next bacteria, vancomycin-resistant enterococci, is resistant to that medication, which is that really potent medication, which means you need even more potent medicine to get rid of that one. So these are not infections that you want to play around with, Now you can get MRSA on your skin. Sometimes, like, people get an abscess or a boil or something. They lance it and open it up and they get rid of MRSA. But I don't really know what MRSA is not really just a nosocomial infection anymore. When I was in school, if you had MRSA, it meant you got it in the hospital. But people, I mean, you go out in the hallways, there's probably people that have MRSA on their skin. Staph lives on your skin anyway. So when you have a cut or something that is, has opened, then it gets in there, that can cause infection. Ingrown hairs, can get staph in them. A lot of times people think they have a spider bite, and that causes staph infection. But usually if it's staph, it already lives on the skin. It could have been a spider bite, but in all likelihood, it probably was ingrown hair or just a cut or something else. And it causes it to swell up and get that abscess. That's a localized infection unless it gets in the bloodstream. All right, asepsis. This is a term that means without disease-producing microorganisms. So this is a practice that we use to keep areas clean and free of pathogens. You've got two types. Medical asepsis, which is like your clean technique. That just means I'm going to wash my hands, I'm going to wear gloves. Sometimes you do dressing changes, like if somebody has a wound or something, it's a clean technique. I just wash my hands, wear gloves, clean up their dressing, put a new clean dressing on, and that's the end of it. Okay, that's just clean. So practices in here, hand washing, gloves, like your normal cleaning. Surgical asepsis is what we call sterile technique. You've probably heard that word sterile before, right? You want things to remain sterile that are going to enter into the body, especially if it's something invasive. So, for example, if you're putting a urine catheter in someone, that's a sterile procedure because you're inserting a piece of equipment into their bladder. And you don't want bacteria on that equipment, or what are they going to end up with? Yeah, a bladder infection, right? It could go up to their kidneys, right? You don't want that. So sterile means that there are no microorganisms. None. There's a difference between clean and sterile, medical and surgical. Surgical means there's nothing. You want your operating room, the OR, right, to not have any microorganisms. If they're going to open up your belly, right, if I'm going to go in for the C-section, I don't want any bacteria getting in there because I don't want an infection. I don't want to have some kind of other major issues. To remain sterile, only sterile items come in contact with other sterile items. So if I open up if I'm going to do some kind of procedure and set out on a sterile field and I've got my scalpels, let's say, I say, okay, I need a pair of scissors, and somebody just brings me these scissors, right, that everybody has touched, and lays them on the middle of my sterile field here, my sterile area that's got all my equipment. Every piece of that equipment is then contaminated. That's just kind of the rules. There's lots of rules that go along with that, but we'll go over that first and we're going to put on sterile gloves. So if the sterility is questionable, then you always consider it contaminated and start over. So like a shot, okay, so if you get a shot, that's considered, you want to keep the needle sterile. It's not really a sterile procedure, I would say, because you don't wear sterile gloves or anything. But you want that needle to be sterile. So if I were to get ready to give you a shot and I accidentally touch the needle with my finger, I have to get a new needle, right? Because my finger wasn't sterile. I don't want to insert that into their body. Okay, standard precautions. Another word you might write in over standard is universal precautions. I use those two words interchangeably. So it could be standard or universal precautions. Those are going to be the same thing. So these are guidelines that were developed by the CDC. Who's the CDC?
Center of Disease Control.
Center for Disease Control. Okay, to minimize the spread of infectious diseases. Okay, infectious diseases are ones that can be spread. Okay, AIDS would be an infectious disease, HIV. Right? A cold is an infectious disease. Chickenpox is an infectious disease. Those are things that can be spread from person to person. Okay, cancer, not an infectious disease. Asthma is not an infectious disease. High blood pressure, those are not. This is something that can be spread. Okay, all blood and body fluids are always considered contaminated. You don't know what somebody has. And there's all kinds of laws involved when you're talking about HIV status, especially. People don't always have to tell you they're HIV positive. You just have to basically assume that about everyone and all body fluids. So you always protect yourself. And that's what these universal precautions are. It's just a way, this is like your everyday how to protect yourself. OSHA, anybody know what OSHA stands for? Occupational Safety and Health Administration. So OSHA is the government agency that aims to protect workers and patients too, but that's for anything. Like there's OSHA guidelines in every place you go to. You've ever been to a restaurant and you go in the bathroom and it might have like some OSHA stuff on there, like about choking or washing your hands. OSHA requires all employees wash their hands or whatever before returning to work. Okay, OSHA is ones that they just aim to promote safety in all healthcare. Not healthcare, but all workplaces. So, PPE, or personal protective equipment, that's an abbreviation you need to know. I know it's on your word list, but you need to know it. Healthcare workers are required to wear PPE when they might be exposed to blood or body fluid. So this is just personal protective equipment. What would you think are some things? Don't look. What are some things that would protect you? You're a healthcare worker.
Gloves.
Gloves. Number one, right? Masks. Definitely. Even hand washing is included in universal precautions.
Okay, they them things that they use in surgery, like under your eyes.
Those are called face shields.
I didn't know that.
Gowns, all kinds of stuff. Okay, but gloves is kind of your first. It's the first one you think of because you use your hands to open. Gown, gloves, masks. Those are all examples of PPE. Things that equipment that you use to protect yourself. It says to choose the right equipment, you have to know how that particular disease is spread. Okay, so universal precautions, because we're about to look at what's called transmission-based precautions. Universal precautions is your everyday, you cover yourself if you're going to be exposed to some kind of blood or body fluid, and you keep your hands washed. Okay? That's universal precautions. That's for everybody. If you're going to be exposed to something, put on some gloves, put on the gown, whatever you need to put on to protect yourself. Transmission-based precautions. Okay, what does that sound like? What's transmission? We're talking about disease.
Something like transmitting.
Right. That is the actual movement, right, of the disease or pathogen from one person to another, right? Transmission. So these aim to prevent transmission, that connection, that communication, or whatever you want to call it, from one to another. So, it says when these special precautions have to be utilized, we say that they're under isolation. If you've ever been to the hospital, sometimes you'll see like red signs on the door. It'll say contact precautions or airborne precautions or droplet or whatever. It'll say that they're in isolation. They have to be kept away from others so that they don't spread that disease. So there's 3 types, and you have to know what the disease is in order to use this. Okay, that's why in the emergency room, when you go in, they always use universal precautions because they don't know what you have yet. But there's 3 types. Airborne is the first one. Airborne precautions, these are used for diseases that are spread by tiny little micro droplets in the air. So you always wear a mask. And you wear a special kind of mask. I have an example right here. You guys can pass this around. Okay. This one, this is an N95 mask. And it's a lot thicker, okay, than your normal kind of surgical mask because this one prevents those tiny little baby air droplets from coming through, so you don't get airborne, some kind of airborne symptoms. An example of this would be tuberculosis, which I think we've talked about before, TB, coughing. It's what, if you've ever watched, which one has Doc Holliday? That one's about our tombstone. Anyway, consumption is the old Western word for TB. But anyway, so these pathogens can stay in the air for a really long time, and that's why it's important to have the right kind of mask. They also have negative pressure rooms which means that if they think you have some kind of airborne disease or illness, they put you in a special room that actually takes air from that room and it doesn't circulate it through the rest of the hospital. It sends it to outside the hospital so that it can be dispersed and it's not, all contained in one little area. And I'm going to finish, the bell's going to ring in just a second, but let me finish because I just have these 2 slides left. Droplet precautions, these are used with diseases that can be spread through coughing or sneezing. Right, so somebody sneezes, it travels through the air, you breathe it in, that's the droplet. Whooping cough is an example of this. Do y'all know the other name for whooping cough? Starts with a P. Pertussis. Y'all probably took a Tdap shot. Maybe, usually you take it when you turn 14, I think, or before you get to high school. So that's an example of that. This one, you can just wear a regular mask, like a regular surgical mask, this kind. It's not as thick as that N95 was, but it will prevent droplets. And then the last one is contact precautions. So these are used when people have skin or wound infections. We talk about MRSA. They're always put on contact precautions if they have MRSA because that is very easily spread from person to person. So you even keep equipment in there. Like if you've got a stethoscope, the stethoscope stays in that room. You don't carry it to the next room because you don't want to carry that disease into the next room either. So gown and gloves. Sometimes you use a mask too if you feel like you can be exposed to body fluids. And hand washing. And that's it. You guys can go.